held on March 11th is going to be a panel of students, and we're going to be talking about mental health from a youth perspective. So we hope that you'll come back on March 11th. Mental health is an important topic. Just a quick statistic, according to the National Alliance on Mental Illness, 1 in 5 young adults are dealing with some kind of mental illness, but as many as half are struggling in silence. And talking about mental health issues may not be easy, but it is an important part of getting those in need the help that is essential. So tonight's agenda includes a short presentation covering topics mental health at different developmental stages, what is typical development, and behavior and signs and symptoms of depression and anxiety. And then after the panel, we'll answer some questions, and then we'll have some opportunity for you to ask questions. If you've taken a card, when we get closer to the time, we'll come collect them if you have questions you'd like to ask. And so I would like to introduce our panel for you, starting over here all the way to the right. We have Dr. Eduardo Bunge. He's a professor in the psychology department and director of the Masters in Science of Psychology at Palo Alto University. Dr. Moira Kessler, she's a clinical assistant professor from the Stanford Child and Adolescent Psychiatry Division. Alicia Carter, she is one of our middle school counselors. She's at Crittenden Middle School. And then we have Kristen Castillo, who's a student services coordinator from the Los Altos High School. And then we're very lucky to have Christine Wang from the Herd Alliance, who's going to be our moderator tonight. So I'm going to turn this over to Christine.
Thank you, Kathy. Okay. So the format for tonight is we're going to give Eduardo about 20 minutes, 15 minutes, and then Maura's going to speak for about 20 minutes. We thought we might share some information. There's just so much information that we feel is important to share with you, as we would like to empower, encourage all of you to find a start point in engaging in some of these conversations. And some of them might be difficult to have, but the kids are right there, you're right there, and so it's a window of opportunity. So we hope that, from the presentation after that, we will have a panel, just 30 minutes for a panel, and then we'll open it up for 10 minutes for questions from you. So, okay, Eduardo.
Okay, thank you. So I'm used to walking, so I need to stand up. Thank you for being here. Can you hear me well? Okay, so I'll talk about two things, stress and mental health, but mostly mental health, yes, and applied to your kids and your everyday life. So let's start saying what's kind of basic definition of stress is events or environments that an individual would consider demanding, challenging, and or threaten the individual's safety. Quick thing, do you think stress is good or bad? Both? Okay, so stress is unavoidable. You will have it in your life, whether you like it or not. Yes, you will have an exam, you will have an advisor reviewing your work, you will have traffic commute, so we cannot avoid stress. And the issue is that sometimes it may lead to positive outcomes. Sometimes we are stressed about something and we act based on that and we perform better. Sometimes we are so stressed that deteriorates or kind of limits our performance. So the whole point is not that stress is bad, and sometimes exposing our kids to some stress is good, because you inoculate them to other stresses that they will have in life. So you expect them not to have any stress at all. That's not good for them. Of course, a lot of stress would also be bad for them, and finding the balance is kind of challenging. And mostly it's challenging because it's not only that depends on the magnitude of the event, it also depends on the resources of the person that is facing that event. Yes. So if you have a stressor such as an exam, and you think that you're not good enough, that may be a big stressor for you. If you have a stressor that is an exam, but you think that you can do it, that stressor may be good for you. Make sense? So the one thing that we will try to focus is, because we cannot avoid exams at all, yes, what we can try to do is to provide our kids with more resources to cope with those stressors. Now, stressors may become a problem when the magnitude and the frequency are so intense that they lead to mental disorders. What is a mental disorder? The basic definition, if you review the DSM, that's the book that we use, is a behavioral or mental pattern. That means you do not want to leave your home every single day. That's a behavioral pattern, yes? I avoid every time I see a dog because I have specific phobia. I avoid that behavior. Whenever there's a dog, I run away. That's a behavioral pattern or mental pattern. I consistently think that things will go bad, will go wrong, yes, and I may have generalized anxiety disorder, yes. I'm gonna be late for the presentation, the microphone won't work, no one will show up, or they will ask me very difficult questions. Please don't ask me difficult questions at the end, yes. But that pattern of thinking may lead to experience anxiety all the time, right? Now, those patterns have to cause distress to be considered a mental disorder. And the distress could be not only for the kid, can also be for the parents or the adults, the teachers. And mostly kids with behavioral problems, usually they are almost fine at the beginning, yes, with the issue, and they put the blame on the adults. And the ones that suffer those problems are mostly the adults, because my kid never follow my directions, yes. Kids with internalizing disorders, those are anxiety and depression, they may suffer a lot, but we don't see it. And actually, in classroom, they may be very nice students. They will never kind of talk back to the teacher. They will always do what the teacher says because they are terrified about doing something wrong. So in those cases, we don't see those symptoms sometimes, but the kids suffer a lot by themselves. This impairment, this distress has to cause impairment, and that, to be considered a mental disorder, should impact either their academic life. I can't study because I'm thinking that things will go really bad or that the exam's going to be really difficult, or their work. In this case, hopefully your kids don't work that much, but probably their social life, yes? If I don't want to be with other kids because I'm afraid that I will say something dumb and they will laugh at me, yes, that may lead to social anxiety. There are different types of anxiety. We'll talk about that later, probably. Monica will talk about that. Now, this is a graph in which what is showing is the rates of mental disorders in the last 6 months. As you may see, anxiety disorders is the one that has the biggest number. Mood disorders is 6.2%. There's a red star. I will show that in a minute why. Behavioral disruptive disorders, 10%. Substance use, 2%. And all combined is 20%. So in the last 6 months, 1 out of every 5 kids will have a mental disorder. Make sense? Now, that red star in the mood disorders is because the rates of depression and suicide has been increasing in the last years, and especially for girls. Now, this is very general. Let's go and try to think which mental disorders start at each stage. Yes? So here you have the age, let me see, age, and here you have the type of mental disorder. In the first years of life, the mental disorder that has the kind of earliest onset is ASD, we call it, is autistic spectrum disorder. And those are kids that have a behavioral pattern of repetitive behaviors or restricted interest or difficulties in social and reciprocity. What comes next, 4, 5, 6 years old, is ADHD, attention deficit and hyperactivity disorder. That's the one that you see kind of at those ages, the kid that cannot stop running. It's not that every kid that is very energetic has ADHD, yes, but those are the type of problems that you start seeing at that age. And important, you start seeing them at that age. That doesn't mean that they cannot start later, yes. Then you have anxiety disorders. I mentioned generalized anxiety disorder, social anxiety, specific phobia. I'm afraid of dogs, I'm afraid of spiders, yes. And then you have obsessive compulsive disorder, those that have to repeat behaviors all the time. Usually kids with this type of problem, they don't share that with their parents because they are kind of embarrassed. They think that it's silly. So, or sometimes they actually include the parents and they will ask you, could you please wash my fork? Can you wash it again? Can you wash it again? Yes. And the parent will wash the fork so that the kid can eat because they need the kid to eat, yes, but they may be reinforcing that problem. Later comes substance abuse, anorexia, major depressive disorder. Usually in adolescence it starts kind of the rates of depression become higher schizophrenia and bulimia. Now, moving this to, sorry, before saying that, very important is 70% of all mental disorders starts between ages 8 and 15. Those are the kids that we have in middle school and high school, probably, right? And elementary. So from the school perspective, we should be doing a lot of efforts to try to prevent this. Let's talk about these disorders, and I will relate it to the different school stages. This is where you see the progression, and in TK to third grade, you should focus on ASD, autistic spectrum disorder, and behavioral problems. TK and elementary behavioral problems, and it's not just ADHD, it's not the one that is hyperactive, it's also oppositional defiant disorder could be present, the kid that's constantly defying every single instruction, yes? In elementary school, we should be focusing our efforts in anxiety disorders and bullying, and later depression, substance abuse, eating disorders, schizophrenia, and suicide, of course. I have LGBTQ at the bottom. Is not a mental disorder, but kids that identify as LGBT may be exposed to social discrimination, and that leads to a lot of consequences, and they have a higher risk of suffering mental disorders because of the environment in which they are at. So that's something to consider. Now, I would like to share with you a report from the National Academy of Science. This was released October of this year, in which they have a set of recommendations of what schools and maybe us parents should be trying to do in order to prevent the 70% of all the mental disorders that starts during childhood and adolescence. First thing is support the mental health of parents, you, by enhancing parenting skills. Did any of you suffer or struggle with the behavior of your kids every once in a while? I have 2 kids in this school district, yes. Today morning, I thought, oh my God, I'm going to be talking about these type of things tonight. Yeah, she woke up with a very bad mood. So having kids with behavioral problems demands a lot of energy to us, right? So sometimes learning some skills on how to give effective instructions make a big difference on how they respond and how we end up feeling. So for example, what's the best way to fail when you give an instruction to your kid? That's one. Ask a question. Say it from far away. Try this. While they are playing video games and you're cooking, preparing supper, say, hey, can you stop playing video games? Try. If it works, come and tell me in your face, Eduardo. But what will probably happen is that they will keep on playing the video game. And just the fact of giving the instruction close to the kid and having eye contact makes a big difference. When I learned that, my life changed. Of course, I still have problems, right? But I think that I have less problems now. It's not just because of that skill. There are many skills that we can learn. And I will talk about later. There's a parenting program in Coursera by Alan Cassin, free. It's 4 weeks. Do it. Available in Spanish, English, Mandarin, and Arabic. So don't tell me I didn't tell you. Yes? Okay. Then we should have programs delivered at school. We should think of interventions that could help large populations, not just individual kids. And we should have population screening at large scales, including the implementation of effective in-person and digital interventions. I highlighted digital interventions because we always think of mental health resources as the work that we do face-to-face. I go and see one therapist in their office an hour a week. That's not easy for us, right? Who can commit an hour a week, every week for 12 weeks? It's challenging. Now, this online course, yes, may teach you exactly the same thing that I would teach you in my office that hour a week. But you can take that course at 11 p.m. once you finish everything. Say, okay, now I will invest some minutes in learning how should I deal with my kids' behavior, right? So online interventions are useful, and I can talk about that during hours because that's my topic, but I will move to the next one. Keep that in mind because I can show at the end some resources that you may want to look at. Support partnerships among schools and community-based organizations, and here we have representatives of Heart Alliance, Stanford, CHAC, Santa Clara County. Gronowski Clinic Center is from the university, from Palo Alto University. And we should have multiple methods of communication and publicizing these type of interventions. We psychologists and mental health professionals have created something that's called evidence-based intervention, which we know that work, but you don't know that they exist. So we need to make efforts to share with you these type of things. Why would I send my kid to a doctor if I don't think that that is useful? Once you know that there are things that have been tested, yes, and that the chance of improving are better than doing nothing, that at least gives me some motivation to go and do it. And that would be my part, and I will leave now the microphone to Moria. Thank you.
All right. Can you hear me? All right, great. Okay, let me just reset the time so I can keep track as well. Reset. There you go. Okay. So the first part of what I was going to talk about today is typical adolescent behavior in comparison to atypical behavior or reasons or causes for concern. I'm not going to go through every single thing that you can read up here, but I think that it's just important to be aware that during adolescence, adolescents are going through what's called separation and individuation. So they're learning how to become their own person. During this time, it's not unusual for there to be more distress. It's not unusual for your teens to try on different hats. They're trying to figure out who they are. It's not unusual for them to experiment a little bit, to experiment with their identity, to experiment with their friend group. It's not unusual for them to have more arguments with their parents. It's actually helpful for them to want to identify more with their peer group than with their family, because that's what's going to help launch them into adulthood. So I think partly what's important to notice is some of the typical behaviors you might see aren't really positive, and they are things that you might be concerned about if you're a parent. So for example, increased argumentativeness or sexual experimentation. Do I have the drug? So increased sensation seeking and risk taking. So different experimenting with drugs and alcohol and things like that actually is not atypical. That doesn't mean that you can't have rules at home. It doesn't mean that it's okay for your kid to come home and for you to find out that they had tried alcohol or had been using a substance. But what it means is there's a difference between typical experimentation and for things to us to be really worried about that they need to get help for. What's important is for you to know what's typical, you really need to know what is going on with kids in this area. And so part of that is getting connected to other parents. Part of that is getting connected to your kids' friends as well, because you don't really know what to worry about if you don't know what's normal. So some of the talks that I've given before, I've had parents really talk with each other about what was typical experimentation with drugs and alcohol when they were kids, and then for them to talk about what they think is typical experimentation around here in this area, because it differs from county to county. It differs from generation to generation, and so you don't really know what's atypical until you get a sense of the environment that you're in. So in general, things to know that there's some stressful, difficult things that are typical to go on as your adolescents are growing up and becoming adults. It doesn't mean that that's a mental health condition, but in order for you to know what is of concern versus what's typical, you really need to kind of pay attention to what's going on, to be somebody who's talking to other parents, to be somebody that your kids' friends feel comfortable talking to you, because they also know what's typical and what's not typical. And if they feel comfortable coming to you, they can let you know when there's a concern as well. I was then going to go over a little bit about causes of depression. So what's important to know is that depression is not caused by one thing, and it's not caused by one category. It's really caused by the interaction of various factors. And we look at it as biological factors, psychological factors, and social factors. So biological factors, that could be genetic, so that could be family history. So like Eduardo was talking about earlier, some parents might have distress. Maybe some parents had their own battles with anxiety or depression as they were younger or at this time too. And in general, having a family history of different mental health conditions does increase the risk of your children having one too. Early childhood trauma or abuse, that could also increase the chances of a depressive episode. There's other different medical conditions that are associated with depression. Also using substances. So alcohol and drugs are risk factors for depression, and they also can be ways that people respond to having depression. So it can go both directions. Psychological factors, the way that I think about that is the way that we think about ourselves, our future, and those around us. Certain people are more likely to blame themselves, are more likely to see the glass half empty, are more likely to feel helpless in different situations. And really, early life situations can affect us psychologically. You know, if we were in really difficult situations and didn't have the chance or the ability to change things, that can make it more likely that you do have a thinking pattern that is really helpless and hopeless. The other factors are social factors, and those are the ones that are easier for us to think about. So that might be social stressors like academic pressure, if there's bullying, if there's, if you move from your old school to a new school, if there's conflicts in the home. But it's really important to know that it's rarely, if ever, just one factor that leads to depression. It's normally what we call the perfect storm of biological, psychological, and social risk factors. So here are the list of symptoms of depression. So it's important to know that in order to diagnose depression, one would have to have experienced at least 5 of these symptoms for at least a couple weeks at a time. That occurs for most of the day and really significantly impacts one's functioning. So I'm not going to, again, go over every single thing on the list, but I was just going to note some things that might be surprising or just might be important to think of as parents. So one thing that it might be surprising is that to be diagnosed as depression, you don't actually have to present with a depressed mood. You need to either have presented with a depressed or irritable mood or to have a decreased interest in or pleasure in things that you normally enjoy. What I've found is that a lot of kids actually present with more irritability rather than actual depression. So if you're noticing that your child really has ongoing irritability, that could be a symptom of depression. In terms of decreased interest or pleasure in activities, that would be looking like your kid who used to spend time with their friends just isn't wanting to play with their friends anymore, isn't wanting to go out of their room. In adolescence, as I had said, it's not unusual to try on different hats. So if your kid used to really like soccer and is now trying on a different sport or wants to do art, that's not unusual to switch between activities, but really it's lacking interest or motivation in anything that they really used to enjoy. And it normally will kind of be globally in really all areas. You might notice that your kids aren't eating as much, or they're eating a lot more, or their eating habits change a lot. I notice with the typical adolescent, a lot of them really don't eat until after school. And while that's not healthy, that isn't necessarily always a sign of depression. What's really important for you to look for is changes in your own child. So typically, your adolescent doesn't go from this child that you love, know, and adore into this monster or this person, this alien you've never seen from another planet. There generally is a progression in changes. And so really, if your kid was really bubbly and their personality was outgoing and spending time with people, and now they don't want to spend time with anybody, that's concerning. So it's looking at the child that you know and seeing if you've seen significant changes. Often we'll see changes in sleep. So people with depression will often either have trouble falling asleep, staying asleep, or will wake up really early. A lot of kids that I see will just sleep all the time. You know, they'll get 12 hours of sleep and then it just never feels like it's enough. So if they never feel rested or always feeling low energy as part of this, that would be something to be of concern. You might notice that they're apologizing a lot or feel guilty for things that really don't make sense. That would be another thing to look out for. Some of them will have trouble with concentrating. So it's not just at school. It might be normally they're an avid reader or really like watching a certain television show and they can't even focus on that. That'd be something to look out for. And of course, a significant symptom of concern would be thoughts of death. So passive suicidal ideation is what we describe as wishing that they weren't born or wishing they could go to sleep and never wake up, not necessarily wanting to do something. Whereas active suicidal ideation would be wanting to do something to end their life. And both of those things would be significantly concerning. And so just to remember at the bottom, for it to be diagnosed as depression, it really, these symptoms would be lasting most of the day. And they're really too intense for somebody to manage on their own. So we heard about stressors earlier. What's important to note is that depression and being stressed are different from each other. So if you look at the green graph, that's really describes typical changes in mood when we're stressed. So for example, let's say that your kid has finals. They're probably not sleeping as well. Maybe their eating habits are different. They're more irritable, but finals are over. It's holiday break. What you'd expect is them to go back to normal. Their eating patterns to go back to normal. Their sleeping to go back to normal. Their mood to go back to normal. Whereas if it's clinical depression, it would look closer to the red graph. So that would be the symptoms are much more intense. They're ongoing, and they're not really wavering as much, and that lasts longer. And so what I'll tell some families, if you're concerned about your kid, really look, is there a difference between the weekdays and the weekend? Is there a difference between finals and vacation? If you're really seeing these concerning symptoms and they're not changing when the stressors are going away, that would be much more concerning for depression than for a response to stress or distress. The slide just talks a little bit about anxiety. So as we heard before, there's different types of anxiety disorders, and the symptoms here are just different symptoms that might present in different anxiety disorders. So worrying a lot about different things, that often might go with something we call generalized anxiety disorder. With anxiety, we often see many different physical symptoms. So especially with younger kids, they don't really have the language or understanding to say, I'm anxious. So you might see, your kid often complaining of headaches or stomach aches or nausea or dizziness, and you're going to the doctor and the doctor's like, there's really nothing wrong with them. That really could be a sign of anxiety or of depression. And so other symptoms might be trouble falling asleep. As you see, there's an overlap with anxiety and depression. It might be trouble falling asleep, trouble relaxing. Panic attacks are really intense episodes with many physical symptoms like heart racing, trouble breathing, chest pain, feeling dizzy, sweating. Those are just different symptoms that we might see with anxiety. Similarly to depression, it would be, you would notice a change in day-to-day functioning. So your kid that's normally outgoing and wants to spend time with friends may want to stay at home and not do activities with people as much. Another thing to be aware of is that for some people with anxiety and depression, you actually might see more of those externalizing behaviors. And I've actually seen this more often with my male patients than my female patients, that you might see them acting out more, breaking rules, some more defiance, maybe some substance use. And so if you're seeing that in your child and that is not, the way they typically would be acting, skipping class, things like that, that could definitely, it's obviously a concern, but the concern might be that it might be coming from anxiety or depression. So that's something to be aware of. We'll talk about this a little bit more with our panel, but I was just going to give a general understanding of the difference between mild, moderate, and severe depression and treatment options. This is also very similar to anxiety. So there's a continuum for severity of depression. When we think of mild depression, in general, your child's able to function in many ways. They're probably still going to school on most days. They're probably maybe not a big change in their grades, but they're definitely experiencing some symptoms of depression. And the thing is, the earlier that you catch depression or anxiety, the easier it is to treat. So the easier that your kids will rebound back to their normal functioning. So it still is really important to recognize and do something about it. When it's more mild symptoms, treatment might include some form of counseling. It might just include connecting with a supportive adult like a parent or a coach, or maybe somebody like a spiritual leader. It also could be helping your kid to learn and practice various coping skills to lower distress. when somebody is experiencing a higher severity, the next level would be called moderate depression. So that's where they're experiencing many symptoms of depression. It's affecting most areas in their life. So that might be their grades are starting to drop, or they really are starting to miss school more often. So at least really one area of their life is significantly impacted, and they're experiencing many of the symptoms of depression on a daily basis. At this point, it really would make sense to get some professional help. There's all ranges of professional help. So outpatient help would be, going to a therapist or a psychiatrist, and you could do individual counseling, might be seeing a therapist every single week. And doing cognitive behavioral therapy is a very common form of therapy. I'm sure we'll talk about that more. It might not hurt to see a psychiatrist and just to have an evaluation to see if medication could be beneficial. Group therapy is another option that often would be going in weekly with a small cohort of kids the same age that are experiencing similar symptoms. And a lot of kids benefit from having that social support system. As it starts to get more severe, there's more treatment that's normally recommended. So with more severe treatment, it's really more severe depression, it's normally almost all the symptoms of depression. It's really affecting every area of life. So that's a kid who's really not going to school almost at all anymore, is having recurrent thoughts of death, or is self-harming. And this absolutely would require professional help, but it might require a higher level of care. So intensive outpatient program is kind of a step up from outpatient. Your kids still would be sleeping at home, but they might be going in for treatment 3 to 4 afternoons a week. And these programs are normally comprehensive. They involve individual therapy, group therapy, psychiatry, family therapy, parent groups. Partial hospitalizations, one level up from that, it's normally about half a day, and would be usually like 5 to 6 days a week. If your child's really in acute danger of harming themselves and really you feel like you can't keep them safe at home in the moment, then they might require psychiatric hospitalization. That's normally very brief, maybe a few days at a time, and that's really just for them to be seen immediately in a safe environment, potentially to get medication started, learn some coping skills right away, and get a safety plan in place for them to get home, and then a treatment plan as well. There are just a few things that are really important to think about in terms of treatment. One is the first provider you see might not be the right fit for your family, and not to give up. So there can often be a wait in getting providers. I'll often recommend families to call every single resource I give them, and then to keep calling them as many times as possible so they're not getting forgotten. Also, give people a chance. So if there aren't any immediate red flags with the provider, really try to have your family give this provider a chance to get to know your family and for you to know them, to see if it's a good fit. And if it's not a good fit, that's okay. That doesn't mean that therapy doesn't work or medications don't work. There's really many types of therapies, many types of therapists, and various types of medications that could potentially be beneficial. When people are depressed, they usually are very hopeless and helpless. So it's really important for your kids to know that you're on their team, that you're there for them, that you're not giving up on them. It's really important for them to know that even if they don't want to get help, that you're going to get them help. A lot of treatments really involve parent involvement, especially with anxiety. As we were hearing before, there's a lot of different things that parents do with the best intentions for their child, but that can also sometimes worsen anxiety. Helping them avoid things that make them anxious can sometimes increase anxiety. So a lot of providers will want to work with parents to help support your children, and similar to depression as well. Let's see. So this is just some basic tips on where to get help. A couple first places to go, first of all, would be the pediatrician's office. So the pediatrician can be a little bit easier for your child to swallow if they have concerns about seeing a mental health provider. If they've been seeing their pediatrician since they're little, it might be a little bit easier for them to feel comfortable talking with them. And pediatricians have really all been trained to do some brief mental health assessments, so they can kind of figure out if there's really any immediate dangers. And if your child does need support, they can really try to work to help connect you to another provider. Another place you could look at is within the school. So different areas might be your school psychologist or school counselor or another trusted adult at the school. They might be aware of other resources that are available within the school or outside of the school. But just know that you don't have to do this on your own, that there's people within the school community and within the greater community who can help. If you're in a crisis, so you're worried about your child's immediate safety, or you're just not sure if you need to be worried about their immediate safety, here's some numbers you can call. You can call 911. I've been told there's something called a CIT officer who's trained in mental health crises. No one's told me if they've called before, so I can't vet them. You can go to the nearest emergency room. I at least know, like at Stanford Emergency Room, we have child psychiatry fellows who will staff it 24/7 and will do a mental health assessment and figure out if your child needs to be hospitalized or what the next steps would be. And really, any of the local hospitals should be able to provide a psychiatric assessment at all times. Uplift Family Services, I think they actually had a table out there. That's another good support. My understanding is there's also a mobile crisis team that you can call, and if somebody is available, they can actually come to your home and do a psychiatric assessment in the moment. And then there's some crisis lines. This is helpful for you to know, and also, yes. Oh, thank you. And also for your child to know about. I've definitely have heard some teens have used the crisis text line and have found it beneficial. But if you also are in a mental health crisis and don't know what to do for your child, it's okay to call one of these numbers and to ask for support. And then, I'm not sure who put this slide up, but here are some resources. You know whose slide this is?
No.
Oh, I think I added this.
Okay.
So a lot of these are, there are, Children's Health Council, which is in Palo Alto, has many, many free parent classes available. And these are some of what is available. And it's just a range. I mean, you can choose, and they're not the only people, an organization who is providing free parent ed, but it really leans into having a more intimate conversation also afterwards. And so it's a smaller venue, and so it might be a nice way to kind of have an introductory look at some of these more niche topics within mental health.
They have a mailing list too. You can get emails with all of the, because they get, they have a email list, so you can get on their email list, and they'll actually send you an email every time they have an event. There's a lot of good ones for teachers and parents. CHC, Children's Health Council.
Okay. Anyways, you can follow up and find that information online. Eduardo and Mara, thank you for helping us, just providing us with a deeper understanding just of the developmental stages and also of the signs of depression and the symptoms, especially at this age level. We're going to go ahead and move into the panel. You know, from being on the Herd Alliance, we work with a lot of schools across the county. And there are many themes that exist across schools. And so we've prepared some questions that we think might resonate with many of you. So what are the schools seeing and experiencing related to stress and mental health? Just being on the Herd Alliance, I hear themes of parents not wanting their kids to have any hardships. I hear kids feeling overparented. And so what are some thoughts?
Hi, everyone. Can you hear me? Okay, so I think they're probably similar in the middle school and the high school. We do see a lot of students that are experiencing symptoms of depression or anxiety. A lot of times they diagnose themselves with the social media. So I think it's important to look at, like, again, what is typical? We all have periods of stress and anxiety. Is it actually you have the disorder, or you're just kind of experiencing that hardship? I see a lot of that related to grades or feeling pressured to do a certain way in school. A lot of it I see in school is with social social groups, like friends that broke up and now they're not getting along and they might be posting something on social media, or like relationships breaking up. So I see a lot of that in the school. And then, of course, we also deal with things that many families deal with, like grief, illness in the family, maybe parents are separating. So it's basically everything that could happen in life, but we do see some themes. I do see a lot of anxiety and depression lately.
Yes, I agree as well. In the high school, like Dr. Kessler said, there's going to be waves of times when students are going to be stressed, especially at the high school level. We talk a lot about balance and normalizing stress and how it is appropriate at times, and making sure we have the correct coping strategies to manage that stress. And so I think just keeping an eye on your students and making sure they're not avoiding things that they enjoy and that they like, and that's why we really focus on a balance. I think where stress is coming out in high school a lot of the times is they are overbooked, they are overscheduled. And with all the best intentions, we want our kids to do everything, to do well in school, to be on athletic teams, band, cheer, horse riding, all these different things that we do in this community. And I think that's great. We want to encourage our students to participate, but we also want to make sure that they're not overbooked, because that is when they start to break down, and that's when we see that. So just keeping an eye on that and making sure that it's a healthy balance along with the classes they pick. I will tell you right now, our students are amazing here, and you guys raise great kids. They're very diligent, they're very smart, they work very hard, but sometimes it's too much, and they also don't know what's too much sometimes. And so I think going back to feeling comfortable having those conversations with your children and your students about how they feel and what they need to be successful, and also what's appropriate and what's a balance for them. Sometimes 5 AP classes are too much for our students, and they can't handle that, and that comes out at school, and sometimes that comes out by not going to school, and I'm sure we'll get into that as well. But again, just about a balance and making sure that we encourage them to have fun still. We really talk about that, believe it or not, in high school. We want them to play still and in a different way, obviously, in high school, but to have fun. And we can't forget that piece of it as well.
Can I add one thing too? I think based off of the scheduling, I also see a lot of really poor sleep habits.
Mm-hmm.
So a lot of the students that I see that are students, so it's from the school, are going to bed too late and or waking up too early. And there's a lot of evidence to show how lack of sleep can really impact mood and anxiety, and it is a risk factor for suicide as well. So I think that's something I've been seeing a lot. Like the average student I see sleeps like 6 hours a night, and I believe at this age 9 to 10 hours is more ideal. And so that's a really big and really bad sleep hygiene. So sleep hygiene is like sleep habits, things that we know are helpful with falling asleep. A lot of kids staying on their phone or doing homework right before bedtime, so not doing things that enables them to fall asleep. So even when they are going into bed, they're not sleeping for hours.
Yeah, we see that a lot.
Well, we know that 50% of all lifetime cases of mental illness begins by age 14. What are the schools doing to reduce stress, provide support, and promote mental health?
Nominated. Okay, so district-wide, we have a health and wellness committee that looks into creating curriculum to give psychoeducation to students, because they need to know how the brain works, all of these things that have been presented here. I think the more education, the better for both students and parents. So we also are training our staff at all of the sites to help identify when there's a concern about a student and speak to them about it. Don't be shy about mentioning it. I think they appreciate when you notice there might be something going on, and then helping them to be referred to some kind of resource, whether it's the school counselor or their parents or some other resource to get them help that they need. We also are doing more within the classroom. Like we have a 6th grade elective wheel that has a health component. So they're learning about wellness, self-care. I see a lot of kids that act like, oh, if I do self-care, that's like being selfish, or like I shouldn't, why do I need to do this? So I think educating them on how sleeping enough, eating enough, exercising, all of that is really important for the mental health. We also have, each middle school has a full-time school counselor, so I'm there for drop-ins or crisis. We have, I think CHAC was mentioned, we have 4 CHAC interns at Crittenden. I'm not sure how many at Graham, but they see almost 40 students individually for counseling. They also run a lunchtime group, more psychoeducation 8-week group. We have Uplift, who's out front. They do mental health counseling, they do behavioral support, family wraparound. They have parenting classes, which I think are very helpful because, again, I think the whole family needs to be involved. I mentioned to Christine that sometimes it's like, oh, well, if the student is getting counseling, then that's enough, where that's not always the case. You need to do more at home. So we're constantly improving, but we do have a lot of resources.
And us as well, we actually just recently hired in our district a wellness coordinator who's going to kind of oversee wellness in our district and kind of implement programs with that. We have something we do for our freshmen called Challenge Day, which is really about building connections with students, teaching about empathy, and so that really kind of builds that collaborative space with our students. We've started doing something during our tutorial time, which used to really be a time where students went to get help from teachers in a subject they may be struggling in. But some of our students, well, we always survey our students because they'll tell you what they want. And so when we're thinking of good ideas, we really reach out to them because they know what they need and what they want. And so they said, you know, it's great to get help from our teachers, but we need some other options. And so we've created spaces for them to have like a quiet space where they literally can just kind of sit in peace. We've created a space where they can do physical activity, like actually work out during that time because they just want a break from schoolwork. We have speakers come and talk to them about things they're interested in. So we've tried to do a lot of different things around that. And just as at the middle school, we've been training our staff on how to support our students and to have those conversations. I'm trying to think. There's so many things. I mean, I could go on. Yeah. We have the mental health resource cards. So some of these numbers that were up here, the text hotlines, we actually have cards that kids can either take a picture of because that's standard for them, or they can keep it in their wallet or their backpack. We have CHAC interns on our side as well, along with CHC intern. I oversee a team of therapists, of licensed therapists that are actually hired through the district that work with students as well. And we're there for crisis. We have 7 academic counselors that are also trained in this. So we have a lot of resources, again, and the big piece of that is partnering with you guys. The school can't always solve the problem, but we are here to support you and to get your students resources, whether that be in school or in the community. And we have like an intake therapist that does that as well, and that will work with students and families to get them support outside of school as well. So, and I would say the biggest thing is we have these boxes on campus. We call them our black boxes. And it is where students are able to refer a friend or themselves, either anonymously or they can put their name. And at first we were like, oh, kids aren't going to do this. But you'd be surprised. Again, your kids are amazing. They look out for each other. We check the boxes 3 to 4 times a day, and we have referrals in there that's, some are very mild. My friend's really stressed out. They're not sleeping. I've noticed a change in behavior. And some are, no, this person has said they're going to hurt themselves. And we immediately check in with that kid. We'll pull that kid out of class if it's a crisis situation. We want to make sure your students are safe. So, and kids take care of one another. And that goes back to building the community. And making sure our students feel like they're a part of our campus, and we really work hard at doing that as well.
For sure. Oh.
This is Los Altos, where I'm at Los Altos High School, and Mountain View has a similar thing. Yes, Yes, Mountain View, Los Altos.
Yeah, I was going to add that a lot of my referrals come from other students for their friends. That's how I get many of my referrals. And this year, I don't know if you have a middle schooler, you'll notice their ID card has the crisis line on the back now, which I believe is a new law that they have to have that.
Let's move into some of the questions. These questions are for everyone. When parents have a concern or feel that something is going on, what are the next steps parents can take? Who do parents go to if they're concerned about their child and may not know what it is?
I can answer. So, I mean, one option is what I had mentioned in the slide was you can go to the pediatrician office. That's somebody that often knows the family who's seen your kid as they grow up, so they can also notice potentially if things are different, and they can do a mental health assessment. If there's somebody sometimes you can go to a school provider too. So a school psychologist is often a good start, and to let them know you're concerned, and the school psychologist can help you figure out next steps. So those are two places that I might start. You can also, if it's like a emergency, that would, like I had said before, like 911 or Uplift or going to the emergency room are right away. And urgent care can do it as well, but I often will say medically, the pediatrician's office, or or from a school perspective, going to like the school psychologist.
And sorry, go ahead.
We have 2 quick slides to share about this question. We knew the questions anticipated. So this is the first one that I would like to share. There's this interesting book about myths of popular psychology, and the idea that adolescence is inevitably a time of psychological turmoil. That's a myth. So if you think that the behaviors of your kid are just because he's an adolescent, that may have problems, because you may kind of diminish their concerns. Yes. So 20% of the kids have problems, but 80% do not. So that leads to my second slide, that is the following. If you have doubts about the physical pain of your kid, how long it takes you to call the doctor? Day, 2, 3, 4. Now, if you have doubts about the emotional pain of your kid, how long it takes you? There's this stigma about mental health, yes, that we don't talk about that. In the schools, we have physical education, but we don't have emotional education in the curricula, yes? And in our heads, that's something that's kind of, and probably because we didn't have the knowledge before, but my suggestion is ask. It may be a 30 minutes interview with the professional, and they may tell you, that's totally fine, go home. Or they may tell you, you know what, do something. Because the sooner the intervention, the best prognosis they have. So why wait?
We're going to hold off on questions. We'll get to those in a few minutes. What are your thoughts for parents on managing their own expectations and anxiety? What's helpful, and when does it become a problem?
So I have a slide for that one too. Sorry, I cheated. But part of my anxiety is difficult questions, so I try to be prepared. Okay, so a couple of things. Here you have one interesting book, yes, in which this book is more for therapists to teach how parents could help their kids with anxiety, yes. Here you have an online course by Philip Kendall, who is the author of the Coping Cat, that is the most empirically supported treatment for childhood anxiety, yes. They launched it, I think it's a month ago. I'm really happy because I was waiting for them to do it. They have the parenting program for anxiety, and they also have the program for the kid. The kid can do the first part of the program by themselves, but the next part of the program, they have to do something with the therapist. Now, regarding your own expectations, a couple of things to keep in mind is, I have it here, is first, be aware that your expectations influence your kids, yes? If you want your kid to be always the best in everything, that's good, but you're putting some pressure on your kid, yes? I'm not saying forget about that, but that has a consequence. Now, we talk about this area as full of plenty of high achievers. which I agree, yes. I think that having this positive perfectionism is good. To have my kid being the best at soccer would be lovely, right? Or the best software engineer, yes, that would be great. Now, why do we need to do that? Why does my kid want to be the best one? Because he thinks that if it's not that, then he's the worst? Because if he doesn't achieve that goal, he is a loser? Then that's the negative side of perfectionism. And we usually encourage people not to abandon the positive side of perfectionism. It's good to try to improve yourself every day. What is problematic is when you think that if you don't achieve that level, you're terrible. And that is what leads us to feel really, really anxious about the possibility of not getting in the best college, right? So my efforts, my suggestion for the parents would be, if you are having this type of conversations, focus on having your kid being able to accept intermediate steps. If you don't accept your intermediate steps, you get farther away of the ultimate goal that you're pursuing. Make sense? So that's one thing. The other thing is to think about what are your values. You want your kid to be the best. Why? Because he wants to be happy? Well, maybe if you put all the eggs in the same bucket, yes, there's some risk. So if your value and your goal for your kid is to have him having a happy life, yes, being the best at something is not necessarily what they need. It's maybe good. It doesn't hurt, right? But it's not the only way to achieve that goal. Make sense what I'm trying to say? So my suggestion would be to try to challenge those thoughts about not achieving that level. Yeah?
I was going to add one thing I see in the middle school is students might come to me feeling a certain way, and they think their parents might be mad at them if they tell them, or that their parent has never felt that way before. And I try to explain to them we're all humans and we've all had periods where we might feel this way, maybe not to the same degree, but similarly. So I think it's important in your daily life at home to, again, kind of destigmatize mental health and talk about maybe, oh, I had a rough day at work, or I'm feeling anxious about this presentation, and that you can get through it. I feel like I see a lot of students that they don't have the coping mechanisms like you mentioned, and then when something bad happens, for example, they get a grade they don't like, or a friend like breaks up with them, they immediately go to like worst case scenario because they don't have that experience of it being okay. Like, I can live through this, I can cope with it. So I think that's an important message, and also kind of doing, you know, some kind of self-care at home, possibly together, or showing them that you're taking care of your mental health, and what you do might not work for them, but giving them kind of some options. Like, I tell them, hey, you can try mindfulness, but it might not do anything, or you could try muscle relaxation, you know, all these different techniques. But I think being, you know, really open about it at home definitely helps open the student up to communicating.
I wanted to add, because I agree a lot with what you just said. A lot of the teens I work with think that every other teen is perfect, and they're not having any difficulty, and they're taking all the classes, and they're in this sport, and they don't have any issues, and I'm the only one. And I feel so bad, because I'm like, I'm seeing half your friends in my office. Just, you know, like, I obviously don't tell them that, but I think that by you talking about your own struggles and how, you know, like, I also have patients that think their parents are perfect too, and that they are able to manage everything too. So I agree, by you kind of breaking down this facade of perfectionism and letting them know that, like, yeah, I do all these things, and, you know, it's hard, and sometimes I need to take a break, and like, I went in the bathroom today and cried at work because that person upset me, and that was hard. And just letting them know how imperfect and happy and great you can, you know, and sad and great, and how much you can struggle too. Because I think a lot of the teens I work with struggle with being resilient, because they feel like if it's not perfect, then it's not worth it. Like, if I not gonna get 100, I might as well just not go to school and take the test, because, like, why fail? I'd rather just, like, be in control of my failure. And so I think really breaking down the barrier of just thinking everybody's perfect, and showing them how you make mistakes and how you respond nicely to yourself with self-compassion, is really important, so your kids can build that, and then they can be more resilient as well too.
And also, I think at the high school level, as your students get to that point, we start to think that they're more independent and we just want to kind of let them be. But I think a couple good points, still getting involved. We invite parents all the time to come to our school to, be part of speaker series and different volunteer activities that we have. So continuing to remain present in that as much as possible, but also having those high expectations of performing in school, but also being realistic and setting boundaries as well. I can't tell you how many families I have come in my office where their student is starting to fall apart and grades are slipping and they're not coming to school because of mental health reasons. And I have so many parents say, but their ability is up here. I know their ability, they're smart. And we agree, 99.9% of the time that yes, ability may be here, but your student is falling apart and they're not able to come to school. They're not able to perform. And so also being that parent and knowing what's best for your student and setting those boundaries and saying, no, it's okay that we drop a class. It's okay that we don't take an AP class at every level. We need you guys to also encourage and support your students in that way, so that they feel it's okay, kind of going back to they don't have to be perfect in everything. Because I do think, a lot of people want to put the blame on the parents. The parents are putting all the pressure on the kids, and we know that's not true. We, especially at the high school level, these kids they're putting the pressure on themselves. And so they still need you, even though they're becoming young adults, and they say they don't want you in their lives, they still need you to say, I'm still your parent, and I'm helping you. I'm going to help you out right now because I kind of know what's best. I'm going to support you in these decisions that you're making. And so really helping them make those good decisions and being an active participant in that as much as you possibly can.
Okay, we've got a few more minutes, a couple questions before we open it up. What are effective treatments for children and adolescents with anxiety and depression? Do you have a slide for that, Eduardo?
Dr. Kessler has.
So I'm a strong advocate of evidence-based interventions. I think that the mental health field didn't have much credibility historically because it was mostly opinion-based. And it was theory-based, and there were no many studies showing that this treatment is better than nothing, and this treatment is better than this other treatment. So knowing that there are scientific treatments, yes, treatments that have some scientific support, I think that it's kind of a better bet now, right, to go to a therapist than many years ago. And what I suggest is ask your therapists, your counselors, your professionals to see who can disseminate this type of, who can deliver this type or provide this type of interventions. And specifically for anxiety, the treatment that has been shown to be most effective is CBT. There's this manual called Coping Cat by Philip Kendall. I show you the online program that's created by the same author. Attention training. Kids with anxiety, they tend to focus on the threatening stimulus. If I'm doing the presentation, I will focus on this parent that is looking to me like this, and I will not focus on the parent that is nodding. Yes. So the attention training consists on having the kid start focusing on the other stimulus too. For depression, you have cognitive behavioral therapy and interpersonal psychotherapy. And for behavioral problems is parenting training. So it's mostly with the parents. It works better with children than with parents of adolescents. For kids that self-harm, there's something called dialectical behavioral therapy. So it's good for you to be informed. And you may not know all these terms, but there's a link that it was shown before. PracticeWise is the site. If you go there, you search blue menu evidence-based treatment. You have the different treatments with the different type of support. And I advocate for parents to request to their therapist, hey, are we doing these type of things? Can you refer me to someone that does this? I think it's important because that will increase the chances of you and your kid receiving the more secure treatment.
I'll add in the medication piece. So for at least moderate levels of anxiety or depression, there's also evidence to support the typical antidepressants or the selective serotonin reuptake inhibitors, SSRIs. There's been good research done in children and adolescents to show that it can be that the combination of medication and an evidence-based psychotherapy can help them get better faster. So in the end, in the big research trials, about the same amount got better with, it was with medication alone or medication plus therapy, I think, right? I'm trying to remember now exactly. But what they showed was that remission tended to be faster when medication was added. And although I'm a psychiatrist, honestly, I don't love medication. And I'm a big advocate for therapy, but I honestly have seen in many cases that some of my patients that, I'll start therapy. Let's say they have mild levels of anxiety or depression. I'll start therapy with them for about 6 weeks, and it's just not budging, and we'll add in an antidepressant, and that's finally when we start to see some change. So it really, I do believe the research, it can be very beneficial, especially if there's a child who's experiencing suicidal thoughts or self-harming behaviors or severe levels of anxiety or depression. What I tell parents is I'd rather give them everything rather than just pick and choose in the beginning, because if there's something that can put them in less distress more quickly, I'd rather have them do that than wait and see. And so that's kind of when I would do the medication piece to start, if I'm really worried with them immediately, even if they haven't started therapy. But it's important to know, if you see a psychiatrist, all you're doing is gaining information. So all you're doing is learning if medication's an option and what that option would be. And you can decide then if you do or don't want to start medication for your child. You can decide later. But all it is a foot in the door, just so you have more information. So if you have any question about it, I'd recommend going and seeing somebody, because if you do eventually decide, yes, I think this is the time, there could be a wait, and you kind of don't want to wait on it by the time you decide that this is really the tool we need to add to treatment.
Speaking of waiting, most people that experience specific phobia, which is a very specific fear of a specific object, such as animals or situations, right? They experience the phobia for 20 years before seeking therapy. Now, can someone guess how long can be the treatment for a specific phobia? Can be 3 hours. There's a one-session treatment that 2/3 of the participants benefit from that treatment. So you've been experiencing a specific phobia during 20 years, instead of going and seeing a therapist, that in 3 hours you may benefit a lot from that treatment, right? So these are the type of things that we never share with the community, we researchers or therapists, right? And that's why you don't come and see us. Yes, you don't come and see Monica. But I think that, I think that checking this type of information will be useful for you to have a better idea of, well, it's worth to go and check.
That's really helpful to hear, because when we speak with clinicians, often parents pause when medication is recommended. And so sometimes that pause, just as you mentioned, if the child is not functioning or going to school, or it's already, the behavior's already escalated, it really, there's no time really. So.
And I forgot to mention that the SSRIs typically take 6 to 8 weeks to fully get into someone's system. So even when you start them right away, there's some time that it takes for them to start making a significant change. So it's just, I don't want someone to wait until things are severe, because you don't want to wait any time for your kid to start feeling better. And so the sooner that you get help, the sooner you find out what your options are, and the sooner you can try them.
Yeah, thank you. And then one last question. We've already shared many resources. Any other last thoughts on resources for parents?
Share the one on parenting skills. This is the course. Yes. Everyday Parenting, the ABCs. That's Alan Casting from Yale University. He's a lead researcher. There you have one slide to see how it looks. You have the captions in Spanish or Arabic, Chinese simplified, and English. And it's basically accessing the person that has been doing these treatments for many, many years. Yes, you can come and see me in my office. I don't see clients, yes, but just as an example. You can come and see me in my office, but he knows better than me, right? So, I don't know. It's a very useful resource. Here you have the one for kids with anxiety. And since we've been talking, this is from the anxiety one. And Mood Gym is an available online intervention for depression prevention and treatment. It's done by people from Australia, and it's pretty has some evidence that works. Yes. This one?
I was trying to find because I ordered it. I can't remember the name of it. There's a lot of books that are helpful for parents to read too. One of the anxiety books I like is Helping Your Anxious Child, and it is based in CBT strategies. There's another one that I'm trying to find in my cart that's really good. It's called like The Worry Cure. I'll find it. For ADHD, I like Taking Charge of ADHD by Barkley. It gives some psychoeducation and some knowledge on parent training as well. Kadson also has a book called Your Defiant Child, I believe. There's How to Manage Your Child or Teen with Intense Emotions. I believe that book kind of talks more about dialectical behavioral therapy, or DBT, for parents. I do like mindfulness-based techniques a lot. So there's some books that are just like Stress Teens, I think one of them, or there's one by Gina Beagle and there's one by Salzman, I think, that are kind of like a handbook for managing stress using mindfulness-based techniques. There's also, I think at least Gina has a local, I think, 8-week course for teens that can do stress management too, that's mindfulness-based. So, I mean, you don't have to remember everything. Again, just go to your one resource and we can tell you more resources. But I'm going to try to find the other anxiety one because that one's good too.
We're also working with Stanford as well with Dr. Who she came to our school a few years ago and did like skits or like vignettes of how parents, like some difficult conversations that parents can have with kids, like topics that come up in middle and high school. And so if we able to nail down a date and have her return and bring her staff with her, we will definitely let the middle schools know as well, so you guys can attend that. I think parents got a lot out of that, and just again how to kind of have these difficult conversations that we may not want to have with our children or our students, because that's important too, just opening up that combo.
I found the other book. It's Anxiety Relief for Kids, on-the-spot strategies to help your child overcome worry, panic, and avoidance. And that it's also based in cognitive behavioral therapy strategies.
Okay, thank you.
Can I add something? I notice a lot of our middle schoolers like to use apps if they're wanting into mindfulness. There's a lot of really good apps out there, and then they get to be on their phone like they like to do. So I have one. I'm trying to hang on.
There's a few too I like.
Yeah, Headspace, Smiling Mind. There's one called Insight Timer. A lot of them are free, so they could try those out too.
Calm's another good one too.
Calm.
Yeah.
Yeah.
Thank you. So we'd like to open it up. Are there any questions? Yes. Okay.
Okay, thank you.
Thank you.
So that would be through like the district website? Yeah. MVWSD website. There's a parent university link.
Yes.
I had that question millions of times, yes, because I would say that most of the kids don't want to go and talk to a stranger about their problems, right?
Oh, the question?
Sure. So I think the question was if you have concerns about your child, maybe they've self-harmed in the past, you've wanted them to get help, but they really have not been interested in therapy, and their father really was not interested in them getting therapy. Like, what could you do? Is that?
So my suggestion is always tell the kid is to at least go one time, and then you can decide. It's easier to agree if you commit to just one time than 12 weeks, right? and there is kind of the the responsibility or the chances of the therapist of making a good job in trying to convince the kid to follow through. If they engage in self-harm, there might be some emotional dysregulation difficulties, and they may not be happening now, but they may happen again. So it's good to build some coping skills so that that doesn't happen again. So I would try to find some negotiation in which, okay, what would you be open to do? Yes, so that at least you don't feel pressure, but I feel like we're doing the right thing and that we are kind of protected.
Yeah. So I mean, I think you can give them options. You know, we can either go to this person or this person. You can try this group therapy or try this one-on-one. So, I like the idea of a foot in the door. So asking them to commit to something small, and also maybe giving them options, but nothing at all is not one of the options. And you can always, you know, incentives work great. So, all right, after we go to this session, like you get to pick where we go out for dinner. But I agree, getting at least somebody to assess them, and then at least they've seen them once, and they could work with you too, in helping to support them and helping to kind of coach you on things to look out for and ways to help them cope if your kid's not willing to go in consistently as much.
And there's a website called Psychology Today where you can go on and use filters, whether you're talking about your health insurance that you have or whether you want to do out of pocket. And you can filter whether it's anxiety or depression, different things that are going on with your child. And it'll give you a list of all the clinicians in the area with their pictures and their bios. It's kind of like a dating website, but not really. I mean, you know, but you could really read about everyone and, oh, that person might be a good fit for my child, you know, or whatever. And then giving them the options of maybe here's a couple people we could go see.
Yeah, I usually convince them by just saying, like, try it a couple times. I do kind of compare it to dating. Like, it might not be a great match the first one, but, you know, that doesn't mean it's not going to be helpful at some point. And you can stop at any time. You're never forced. And it might help to kind of compare it to going to the doctor. Like, okay, you have this pain you don't understand. You would normally go to the doctor and get checked out, right? So this is kind of a similar thing, only it's, you know, your emotions and your mental health. And I think as long as one parent agrees, or if they're over 12, you could tell me about that. At our school, you can sign a minor consent if you're 12 or older. Therefore, you don't need parental permission. And if the parents are together and one signs the consent form, that's enough for the treatment.
And ultimately, if they don't agree, I think that for the parent to go and discuss these things with a professional, that would also be useful, right? Because there might be some things that you can do to help even the kid is not there.
So to respect everyone's time, I'm going to go ahead and wrap up. I just want to thank all of you for all the important ways that you contribute to your children's lives. And on behalf of the district, the Herd Alliance, the County Behavioral Health, we really just want to thank you for your time today. Our next event is going to be a student panel where we have high school students coming to talk about their perspective on youth mental health. They will also bring their brains that are engineered for creative solutions. So you can ask them any sort of challenges that you're having with your own children at any age, and they will give you some great ideas. Usually at the first event when we had Mental Health 101, we had parents who were trying to problem solve and differentiate all the different ways to approach their kids. And I was thinking, wow, the high school kids have so many solutions and ideas. And that's going to be on March 11th. So we hope to see you then.
Is that here?
It'll be here. Yeah.
Glad you're so prepared.
It's my way of dealing with this.
Mine was just avoiding the emails. The kids always laugh.
You know what?
Well, because it's true. Like, I've gone to people
I've
and
been
I'm
here
like,
for
okay,
7
I'm never
years,
going to see
so
this person again.
in Spanish, I may not have all the things. So I know that they can see it freely, but I feel like I need some support too.
Yeah,
I wish I'd
no,
signed
that
it.
makes
No, it
total
wasn't an
sense. So it
email.
kind of gives you like a good
No,
template.
Yeah,
definitely.
and also if someone doesn't understand you.
Honestly, just like after a full day's work,
From an
I
audience
just not have
perspective,
able to get the words out, and that's my native language. this.